not sure about this. Hi, Jackie. I'm not sure about this. What's it called? Oh, that's better. Filter. A bit dark, that. Yeah, welcome to another Q&A with yours truly. Any questions in the plastic surgery world, gratefully received. And always delighted to see that people have responded to the sticker. And we've got two sticker responses, which I will answer initially. Just made a note of them. I don't know how to get them up here. There's probably actually there you go. Why is calves liposuction not offered a lot? Do you do it? Yeah. No, I don't do it, and I agree it's not offered a lot. I think it's not offered a lot because there's not much fat in the calves, and it's quite hard to contour it, and it's just not something I've got much experience of. I don't know if there are people out there who have got experience of calf liposuction, but I would imagine it'd be quite hard to do because the calves are made up an awful lot of muscle and not much fat, and the risk with liposuction is creating contour deformities, particularly when there's not much fat, because if you take away too much fat and you get a little bit of scar tissue going between the fat and or between the skin and the muscle, then you could be in trouble trying to fix that. So it's not really, for me, liposuction is really good if you have got a localized area of fat. That is a problem, particularly after weight loss. So it's not really something that you would do for people who are overweight. So if you've lost weight and there's an area of fat that's a problem, then liposuction is good. But sort of contouring a whole calf, I have had people ask for it, and I understand it when I see them, but it is a little bit difficult to do from a surgical point of view. And to be honest with you, it's just not something that I personally have got experience of. And as I say, I don't even know if there is someone out there who does a lot of calf liposuction. Maybe there is. In which case I'll refer my calf liposuction patients to him, but it's or her, but it's a or them. It's not a common request, and when it is requested, I can't really see a localized area that I can do anything for, and it's usually sort of globally the calves are a little bit big, and ankles as well. I think people sometimes ask for, so it's not really something that I can't really see how to address it. So in answer to the question, why isn't it offered much? I think it's not that common a problem. I mean, maybe it's I don't see people because I don't offer it. Maybe that's the way around it is. Maybe it is a common problem that I'm just not seeing. But from a surgical point of view, it's difficult to know how to address it. And you probably, if you do want calf liposuction, you probably do want to speak to someone, a surgeon who has experience of it, who can help you and can sort of give you some idea of what might be possible. And I'm probably not that guy, as I say, unless there's kind of like a localized issue or problem, specific problem. I might be able to do some liposuction to address that, but I don't think I would be great to address a sort of globally large thigh. I don't really think that's my bag. And the other question, which I've been stickered about, is can you liposuction the bottom to make it smaller, naturally big? There's an emoji there, and shape it. Right. Well, it's one of those can you kind of questions, and sort of should you. So can you? Yes, you can liposuction anywhere, and there is fat in the bottom, and you can liposuction the bottom. Again, the bottom and the buttock contouring is not really an area that I've been sort of focused on much. I mainly do breast and tummy. But the issue with doing liposuction anywhere, and for someone, particularly somewhere like the buttock, you're sort of saying, can you do liposuction to the buttock and shape it? And those two things are sort of going against each other a bit, because if you're doing liposuction to the buttock or anywhere, you're going to remove volume. And if you're going to remove volume, you're going to create sag. And so that's the problem. That would be the worry of doing liposuction to the buttock, that you wouldn't shape it. Shape it usually means kind of tightening it, and tightening it means either cutting out skin or adding volume. Adding volume tightens things, and that's the more traditional approach to buttocks is adding volume to the buttocks to tighten it and give it more shape. So I think the concern of doing liposuction to the buttocks is that it would have an effect of making them smaller, but it might make it sag a bit, it might make the skin sag if you didn't do any skin excision. If you did do skin excision, then that's really bad. Well, again, I don't do it, so I'm probably not the person to talk to about it. But the worry is putting buttock scars on the buttock. You kind of try and hide them, so you put it in the crease, in the buttock crease. Wound healing is a real problem. You can't sit on that area for quite a while, so it's just really difficult surgery, difficult post-op management. And again, you want someone who's doing this sort of thing a lot. But I think in general terms, liposuction to the buttock to make it smaller might have an adverse effect on the shape. So that might be something you think, oh, crikey, if I want it smaller and shaped, that's not, I don't think, going to be possible with liposuction. People do this assisted liposuction, VASA, things like that, which has got sort of energy assisted delivery as well as the liposuction. And they might say that and the energy is supposed to tighten the skin. That's kind of the idea about these energy types of liposuction. So it might be worth looking at an energy liposuction. Maybe they do tighten the skin. I've not seen fantastic results in the terms of the skin tightening personally, but as I said, again, I don't do that type of thing. So probably worth talking to someone who does do that type of thing to get a view on whether that might be an option for the buttock liposuction and shaping. But yeah, difficult areas. And when you find that there's not much about it, like calves and buttocks and buttock liposuction and things, it's probably because it's hard for us to get good results, so we don't do it very often. The traditional areas, your tummy tucks, your breast lifts, your face lifts, they are areas where we know we can get good results. We can kind of hide the scars, and that's why they're more common, really. So if it's not very common, you've got to think, why is it not very common? I had a question up here. What scars will you be left with after a breast reduction? Thank you. So they do vary, the scarring. Now, pretty much all breast lifts, I say pretty much, I think probably all, I think I would say all breast lifts, all breast reductions involve a lift. So if you're going to reduce the volume of the breast, you're going to tighten the skin envelope as well as reducing the size of the breast. You kind of have to tighten the skin. If you just reduce volume and didn't tighten the skin, they'd sag even more. A bit like going back to the buttock thing. If you just take volume out, if you just do something like liposuction, for instance, to the breast, and just take volume out, you're going to make it sag more. So you, as well as taking volume out, you've got to take skin out. And that's going to cause scarring, scarring on the skin. And the lift involves moving the nipple up to a higher place and tightening the skin envelope. So it's always a scar around the nipple because you have to move the nipple, so that's a given. And there's usually a scar that goes vertically down from the nipple. And in my practice, that's kind of the minimum. And I would usually also put one in the fold of varying lengths, the horizontal one. Now, some people, and someone recently was asking me about having it with just a circumareolar scar, with just a scar around the nipple. And again, scarring is not good, and if we could use less scarring, that would be better. The problem with doing less scarring is you take less skin out and you get less of a result. And in my hands, just putting a scar around the nipple for a breast reduction does not give a good shape to the breast. The scar's always puckered because you're like taking a donut of skin out to tighten the skin, and you're making a big circle into a small circle, so the scar's puckered. And it doesn't give good projection. It kind of flattens the breast and it doesn't give good projection. So I don't particularly do that one. Some people will use the vertical scar quite a lot, so around the nipple and down. But I pretty much always put a scar in the fold as well, a horizontal scar in the fold as well. If you're just doing a circumareola around the nipple and down scar, then the down scar allows you to take skin out in a side-to-side direction. If you're just doing a circumareola, you're just bunching the skin up. If you could do, once you put the down scar in, that means you can narrow the breast and take the skin out in a side-to-side direction. If you then put a horizontal scar in as well, so-called anchor or T-shaped scar, then you're taking out skin in an up-down direction as well as a side-to-side direction. and that can give a better shape. And the problem, particularly if you've got a lot of skin, if you don't do that horizontal scarring, you worry about getting folds and things. And they say they do settle, or they might need to be revised at a second stage. But I think it's better to put that horizontal scar in personally and give a better shape. So the scarring for breast reduction for me is around the nipple, vertically down, and then also in the fold where your bra sits. Inverted T-shaped scar, anchor scar. Try and make the T as short as possible. So try and make the horizontal scar as short as possible. But the bigger the lift, the more skin you've got to take out in an up-down direction, the longer the horizontal scar. So always try and make it as short as possible. But to be honest with you, out of the three, the horizontal scar is probably the one that's more obvious if you look at it, but you often can't see it because it's kind of hidden in the fold. And the ones at the top, the sort of the one round the nipple and down, are a bit more obvious than the others. So my mum wants a small growth removed from her upper eyelid. Can we get her book in for a see and treat? Of course you can, Natalie. Of course you can. Book her in. What we do with the see and treats, Natalie, is we probably the best way to go about it is to send us a photo. And there should be a way. I think if you go on the website, on the mole page, I think there's a button that says WhatsApp as a photo, and it kind of goes to the WhatsApp to the clinic mobile. And if you send us a photo, then we can give you an idea how much it costs, so you know how much it's going to cost kind of before you come. And then yeah, just book a see and treat appointment. That's fine. We'll see you and treat you. And yeah, very, very happy to do that, Natalie. That's what we need. Bit of business. Doing business on the live, yeah, doing business. Anyone else want to book in, let me know. I'll put you in. But be very happy to do that, Natalie. See you soon. Great, yeah. So thank you. Right, what's we got? I got some questions loaded up here somewhere, which I will see. I've got them on the screen on the Facebook, but I can't do that on the and on YouTube, but I can't do it on the Instagram. Can't get it on the screen. But anyway, here we go. Why am I struggling to find a surgeon in the UK to see me following going abroad for surgery? Good question. We get a lot of this. Oh, got a lot of it, and I got to be honest with you. I feel bad. I do. I feel bad. The problem is that if you have cosmetic surgery, plastic surgery, the way it's structured is different to other kinds of surgery. It's different than if you're having a hysterectomy or a hip replacement or a cataract or a hernia repair, because cosmetic surgery has a pricing structure which involves a fixed price package. I've been thinking about this a lot, and I think this is the nubbins of what it comes down to. If you have another kind of surgery, particularly if you're insured, your insurance company will pay for you to have that surgery, the hysterectomy, the hernia, whatever. If you then need to see and they'll often have 2 or 3, or they'll have 2 outpatient appointments or something included, which are all included. But those 2 outpatient appointments, the surgeon will get paid for by the insurance company. Your insurance company will cover a certain amount of the problems. But if you have a problem, if you have to go back to theatre, if you have to have a revision, if you're not happy with the way things look, or if you've got an issue and you need further surgery, the insurance company will pay for that. The surgeon will get paid for that. The surgeon gets paid for every time you have an operation. So, you know, in terms of the income, as plastic surgeons, people often look at us and see how much we get paid for an operation and think, wow, you get paid loads of money for an operation. I don't get paid, you know, anywhere near that amount for my operations. I feel like saying, yeah, but we only get paid for that one operation. That includes looking after this patient and making sure it's all right. That includes making sure that you see them in clinic. That includes making sure that if you need to do any revision surgery, you do that revision surgery and you don't charge. And that's part of the fixed price package. The hospital doesn't charge, the anaesthetist doesn't charge, and the surgeon doesn't charge if you need a revision of your surgery. And that is all included in the price. So if you go abroad and have surgery and then you come back a week or a month later and you're not happy with the results of the surgery, the amount you have paid when you've gone abroad has included the aftercare. That is part of the amount that you've paid. You have paid for the aftercare abroad. And you can't just then ring up and someone local and say, can I, I'm not happy with the result. I had it last week or last month or 3 months ago, and it's all gone, doesn't look right. You're going to struggle to find a surgeon to take you on, because we don't really have a structure where we can just take people on for the aftercare. We don't have a price where you say, okay, come and it'll be £15,000, please, and I'll see you in the clinic. We just have we just have prices for the operations, and it's often more difficult, to do revision surgery. It's often you don't know what the original surgeon's done, the scar tissue involved. You're obviously already unhappy, so you're kind of on a back foot. So it's a difficult world to be in, and one that I think many surgeons, myself included, don't really relish the thought of taking on problems of surgery that may or may not have been done in a not great way. And it's just really hard fixing problems. And it sounds really unhelpful to someone asking for help, but the honest answer is it's much better to do it right first time. I mean, I know that's unhelpful once you've had it all gone bad, but you got to kind of question why there's such a range of prices for procedures. Often people say, there's no way I'm paying that. I'm going to go to Turkey, or I'm going to go here or there because it's a fraction of the price. You're ripping me off, man. And you're like, yeah, I know it's a fraction of the price at other places. I don't know why. You've got to ask yourself why. And maybe it's because there's a difference in terms of how well they perform their aftercare and revision, etc. And maybe that's why it's more expensive here. And so you can't kind of then pay the fraction of the price and then say, actually, you know what, can I get it done here? Well, no, because all the people that I treat have paid the price that I've charged, and my duty is to look after them and make sure they're right. And I don't really want to take on other people's issues and problems, because that's their duty, that's their problem. And I think we've got, so I don't want to run into the next question. Don't want to cannibalize my own questions. But that's the nubbins of it. We don't have a structure where you get paid, X for the surgery, and then you get paid for each consultation. If you know the surgery, get paid again. The amount you pay for the surgery is inflated because it includes the aftercare. We don't really have a pay-as-you-go structure for cosmetic surgery. We have a one price which includes all of the aftercare in it, and we don't really have a price for just the aftercare. So that's the sort of logistics behind it. But the emotional side of it is always difficult surgery, and it's always it's always difficult getting involved with someone else's problems. And then this question says, what should I do if I cannot contact my original surgeon following surgery and I have concerns? Well, again, sadly, I do hear this a lot, and it goes back to the thing I did about barbs. Barbs asked me to say, what's the importance of having a barb surgeon? And if you go with a reputable surgeon with a reputable clinic sort of outfit, you will have somewhere to go if the surgeon has moved or dies or goes on holiday or retires or whatever. You will be able to go to the clinic or the barbs or whatever to say, look, I can't get a hold of my surgeon. Can you help me? And they, if that surgeon is a member of a registered body like that, then they will be able to say, hold on a minute, this is a patient of yours you need to be looking after, because we have a duty to patients to look after them. If your surgeon is not a member of any of these sorts of organizations, and if the clinic is not a sort of reputable clinic, because if you can't get hold of the surgeon, I mean, often the surgeon, it will be like the clinic or the clinic nurse or what have you. So you often, you may not have a direct link with the surgeon. I mean, it's quite rare to have a link with a surgeon like this. you know, you got the link with the main guy here. You know, you don't realize how, you know, rare that is. Direct link with the guy. He's here. That's him. That's him. But it's rare. Yeah, it is rare to have a link direct with the surgeon. So it's not unusual to not have a direct link with the surgeon, but you should have a link with the clinic who can then talk to the surgeon and get back to you, and then, you know, arrange for you to be able to see him and what have you. So it's really, if you kind of can't get hold of the surgeon, then you should go to the clinic or the facility where you had the surgery and say, look, what's going on, because it's sort of up to the clinic really to look after you if the individual surgeon's not doing that, particularly if the surgeon just kind of works for a clinic, because the surgeon might move on. But most of us want to kind of look after our patients, and I think most surgeons are quite keen to look after people, but I do hear stories of people not being able to get hold of their surgeons. But yeah, so what should you do? You should go to the clinic, and then if you can't get hold of them at the clinic, or if there's a problem with the clinic, then you should talk to well, ideally prior to surgery, look what registered bodies are there, members of BARPS, BAPRAS, things like that. See what bodies they're members of, because there will be a code of conduct. We have a code of conduct that we are expected to work within in those organizations. So that gives you another layer of accountability or recourse if you have any questions or anything you want to bring up and you can't get directly access to your surgeon. When having a breast reduction with a free nipple graft, will the areola be made smaller? Yes. So when having a breast reduction, never mind free nipple graft, it's made smaller with all types of breast reduction, because usually what happens with a breast reduction is that the skin is stretched when you've got big breasts. Breasts have made the breast bigger, and that the areola is part of the breast skin, so the areola is often too big. So reducing the areola is an integral part of breast reduction, and whether it be with a free nipple graft or not. And so yeah, so that is usually we have a thing in theatre which is like a circular thing, which is usually about 4 centimeters in diameter. You can have a view on it if you want. You can certainly talk about if you want to have it a certain size, your areola, if you want it a bit bigger or a bit smaller, but 4 centimeters is kind of like the norm. So yeah, there it is. Is it normal for my ankles and legs to swell after having a tummy tuck? I wonder if this is someone who's asked recently, because I tell you what, this heat, oh my God, everything swells up, doesn't it? Your hands, oh, my hands. Got to be careful if you're wearing rings, you know. But yeah, I mean, probably your things are swelling up if you're not moving. You got to be moving. You got to keep moving. Keep your ankles, keep your hips moving, keep your knees moving. When you are sitting, sit with your leg up, just to help if they are swollen. But everything kind of slows down after surgery. So yes, it is normal for everything to swell up, your ankles, your legs, as well as your tummy, of course. But keeping mobile is really important. And if you're not keeping mobile, keep everything moving while you're watching telly. I am 65 and considering a breast lift and tummy tuck. Would I be suitable for a combined procedure due to my age? What are the risks? Things have changed a bit about age, and it's become a bit more pathology orientated rather than age orientated. We're becoming less ageist and more about how healthy you are. So kind of like if you're 64 and healthy and get out and about and, you know, go down the shops, driving, stuff like that, then should be fine. 65, sorry, not 64. But if you're like 50 and you've got like asthma and you can't breathe after going up a flight of steps, and you've got heart problems and you're on medication, then that might be a problem. So it's more to do with your medical condition rather than your age. I think in this day and age, 65 would not be considered to be, oh crikey, oh Lord. Oh God. Flipping heck. It's okay, everyone. I'm all right. It's okay. I'm all right. I'll be honest, my tripod is down there somewhere and it broke about 6 months ago. So I have been precariously, I'll be honest with you, it is precarious. Precariously putting my, Precariously putting my right, sorry. Oh god, it's not going to be good for the ratings. This, come on, guys, get it back, get it back. Right, okay. Let's okay. Can we? Okay, we're coming to the end. Sorry about that. So yes, right. Let's. Sorry about that. We have to put it in a different angle because the tripod is currently under repair. So the tripod, it's on my list of things to do. I think it's. I did actually glue it and it didn't work. Anyway, God, what was I saying? Oh yeah, combined. Yeah, so 65, absolutely fine for a breast lift and a tummy tuck, assuming you haven't got comorbidities, assuming you are medically fit. If you have got comorbidities, then obviously we'd have to look into that, regardless of your age. But specifically about your age, it is not. It's not in itself going to be a problem. But having said that, we would talk to the anaesthetist to make sure the anaesthetist is happy, because at the end of the day, to be honest, the anaesthetist is going to need to be happy as well. Actually more important than me, what are the risks? So the risks of a tummy tuck, well, the main risks are wound issues, wound healing problems, obviously scars. Not really risk, scars are definite. But particularly with your age, things that we'd be worried about are things like DVT and PE due to not walking enough, really. So that goes back to walking, moving, keeping everything circulating, because DVT, particularly with a tummy tuck, is a big risk. Clots in your legs, which can then fly off into your lungs, form PE. So that's a big issue, DVT and PE. Chest infections, yeah, those are kind of risks. The other risks are kind of long-term asymmetries, poor scarring, unhappiness with the size or the shape, things like that. So that with any sort of cosmetic surgery, those are kind of risks, I guess. But the big one for tummy tuck is DVT and PE. So that's why we make a big deal about you moving and keeping everything circulating with those things. So yeah. Wow. Okay. Sorry about the camera malfunction. Well, I will do my level best to have it fixed by next week, but I probably won't. I'll be honest with you. I probably won't have it fixed. It'll probably be still down there, or I'll try and precariously put it next to the Facebook camera. So if that's it, I'm out. I'm out of questions. So I am going to go and have a cold bath. I suggest you do likewise, and I will be back same time, same place, Tuesday, 7 p.m. If you've got any questions, call me, email me, Instagram me, Facebook me, YouTube me, or do whatever you want. Yeah, did I say email? And I'll do my level best to answer them in next week's installment. So thanks for coming. Have a lovely evening. Enjoy the sunshine, and I will see you next week. So you have to stop.